If we increase the amount of blood flow going to that vaginal wall, we're going to increase the amount of lubrication. And if we have that lubrication, it also fits the good bacteria that we have in the vagina. I'm not saying have sex when you don't want to, but sometimes you do need to start doing something in order to get into that.
Welcome to the Femtech Health Podcast. Today we're joined by Dr. Alexandra Dubinskaya, who's a urogynecologist and sexual medicine specialist. We're going to dive into all things related to female sexual health, the importance of addressing sexual wellness at all ages, and the innovative research surrounding vibrators and their benefits. You're going to learn why sexual health is crucial for overall well-being, how external stimulation can improve pelvic floor conditions, and the exciting new AI-driven wellness device, Sensara, designed to enhance pleasure and lubrication. All right, let's get started with today's show.
I'm here today with Dr. Alexandra Dubinskaya. She is a urogynecologist and she's a sexual medicine specialist. I love some of the work that you're doing. You're coming back on the show again with us, and we're talking about sexual health this time in way more detail, just so everybody out there who's listening knows. Dr. Dumansky, I want you to just share a little bit, like, why do you feel so passionate about this space of sexual health? And then we're going to get into a little bit of your work with Sensara, because I just want people to know, like, what's happening out there and what's being talked about. And so just share, like, why this avenue of your work is so important.
Of course. Well, thank you for having me back. I'm very excited to talk about the topic that actually passion of mine. And I think the female sexual health is very under-researched, under-taught, underrepresented. So when there is an issue with a male sexual dysfunction, sexual problem, they go to urologist. When women trying to have babies, they go to a OBGYN. But when there is an issue with sexual health, there is nowhere to go. So because I take care of women usually who had like pelvic floor disorders like incontinence, prolapse, um, those women tend also to have sexual issues. So they always go hand in hand. And it just happened that I like to treat both conditions, pelvic floor disorders and sexual dysfunction. So, and I think I'm really making a change in women's life by providing them solutions on like how to have a better sexual life, because sexual health is part of general health and it impacts our general health, and it also can be kind of like a window into our general health. If something doesn't work, similar with male erection, if there is an issue with erection, we know that there would be a heart problem either ready or coming up. So similar to the women's with their sexual issues, we can actually predict what's going to happen with their general health. So, and in my everyday practice, I treat pelvic floor condition, sexual dysfunction, and it fulfills me. And I'm very excited that I have this opportunity to help women.
Mhm. No, I absolutely love it. I know before the show we were joking about, geriatric sexual health. And I think we mean it in a way of that we don't realize that. I think women, in our earlier years, maybe we don't think as much about it unless something comes up. Maybe if someone has endometriosis or, some infertility issues or things of that nature. But otherwise, people really maybe aren't thinking about it until suddenly they enter into perimenopause, menopause, postmenopause, but we don't realize that that starts way earlier than people are actually understanding. And we need to open to the door, right, to a lot of these topics and discussions so that people are addressing it way earlier than, waiting till they're 65.
Absolutely, Sherry. And I think you're bringing up important point. Like people, when they think about sex and sexual wellness for women, they don't think about like 75 years old having sex. It's usually like promoted in a like general media that it's like 25 hot blonde women. I mean, blonde is not like obligatory, but in general, like hot women having sex. And then it's kind of like we never talk about sex when you go through the menopause and later. And it's
Mhm.
not only just in general public. Majority of research, if you look at the research papers, the research is not performed in women older than 65 years old. So we actually don't know what's going on there. Um, I'm very curious what's going on there, and I love talking to my patients and see like how they adjust, what they found, what's working for them. And we do need that to have that data in order to improve the sexual function, uh, bring more pleasure because we're still living our lives, and because of our life expectancy getting longer, that's great, but we
Mhm.
also want to enjoy life a little bit.
Well, and I think, there's this misconception, but I mean, a woman can have an orgasm till the day she dies, right? Like she's got all the systems set up. It's just keeping these systems healthy, right? Throughout this whole time frame. And I think why has the perception been like, oh, well, she gets a certain age, oh, there's no more action going on. We're not even going to study him. We're not even going to look at it. And you and I are like, no, this is not really what is happening.
Yeah, and again, there's so much stigma around it, and there was actually studies were done that ask like doctor whether they asking all the patients about the sexual health,
Mhm.
and interesting finding was that doctors feel uncomfortable talking to women who is older about sexual health. They felt like it's inappropriate.
Mhm.
And same as women, they also like some feel like kind of embarrassed to say that, you know what, we're still like fooling around with my 85 years old husband.
Mhm. 100%. And I think this is what's not, first off, we're not studying, but and then we're not talking about it. And then when my patients are coming in, they want to talk about it because they know I talk about it every day. But, I'll just tell you this. I think early on in my practice in the pelvic health world, you know, people didn't quite know how to tell us how to talk about it, and I think now we've done so much better in the last 10, 15 years of like even in our space of pelvic health, literally from day one having the conversations. Well, are you having intercourse? Are you, oh well, you're not having penetrative sex, but are you doing these other things to keep all the floor and the organs and everything healthy? So now we're getting more definitive, I think, with our people of like more data, like, okay, well, maybe you're not doing this, but are you doing these other things? And kind of, not in a probing way, but in an appropriate way to help people understand, well, these things are good. Do you know what I mean? Even if your partner can't have penetrative sex yet, these components keep both of you really healthy, right?
Yeah, absolutely. And if you think about it, like we always told to exercise, go on the walks, um, keep the blood flowing in your legs, stretch. But what about our pelvic floor, like our
Mhm.
genital region? Don't we need to have a blood flow there? And it's
Mhm.
actually brings us to the point and the question that kind of served one of the um, basics and reasons why we did research when I was in fellowship at Cedar Sinai.
Mhm.
In urology, when man has a prostate cancer, it's common practice to give Viagra to keep the blood flow going.
Mhm.
But for women, nothing like that is done. So you had your uterus removed, you had something else
Mhm.
happen. Like, okay, good luck. Um, and we ask ourselves, so what is the one device or intervention that women can do in order to promote um, having a good blood flow, like kind of like rehabilitation? Because going to pelvic floor physical therapy can be very costly and time consuming, and we all busy people. So, and we came to the conclusion that actually vibrators can be one of the good modality for that. And the reason being that, first of all, we know that when we apply the vibration to an organ, it causes vasodilation. So the blood vessels dilate and it brings more blood flow to that area where we apply the vibration. And then we also know that vibrators is very accessible and anyone can have it and use it.
Mhm. Mhm.
So, and that served the basis of our research that we conducted, the prospective study we recruited women and we did not discriminate by age. We had a lot of women in a like older than 65. And we gave them vibrators and instructed them to use the vibrators 2 to 3 times a week for 3 months. Part of our protocol was to apply the vibrator for like external genitalia for 10, 15 minutes. And the reason why we decided to do it externally, because there's a lot of, especially mature women, who just due to the vaginal atrophy, due to the changes that happens with aging, they're not able to insert anything vaginally. Or there is also some women who more prone to develop urinary tract infection, and they have this concern that if they're going to use vibrator internally, it's going to like cause the UTI. And also, again, 80% of women in general experience pleasure and orgasm with external stimulation. So, for all of those reasons, we decided to have the external application of the vibrator as part of our protocol. And we assess the physical exam. There was a lot of questionnaires that were targeted the pelvic floor health, the genitourinary health, mental health, sexual health. And we made assessment before and after the intervention. So, do you want to know the results?
Yeah. Yeah.
Yeah. Well, interestingly, women noticed significant improvement in sexual function and sexual satisfaction. It was significantly easier to reach an orgasm. They also noticed improvement in the pelvic floor symptoms. So women who had the prolapse, obviously the prolapse didn't go back in, but they noticed that the symptoms of the prolapse significantly decreased. Same as for the urinary incontinence. Yeah.
I just have to say that's huge right there, what you just said about POP, pelvic organ prolapses, because think of it. I mean, we're constantly in our world saying that, right? Blood flow, blood flow, blood flow. I love this just with this external stimulation saying that much blood flow came that we actually saw some changes in symptomology. That's amazing.
Yes. And what's interesting is we were also assessing the vaginal atrophy, and there was improvement in vaginal atrophy. Again, we do need to conduct more studies because till this day, we don't have like a grading system that we can easily implement on a physical exam. So we still need to do more studies. That's actually in the process right now, to evaluate better, like to what degree and what settings can improve the vaginal atrophy. But I think the reason why the pelvic organ prolapse symptoms improved is because there is no more, like the friction between the organ and the vaginal walls decreased. So, and I think that happened because also we have a little bit more lubrication, more blood flow, right? And another interesting finding is the skin condition, lichen sclerosis. It's a condition that common in premenarcheal girls, women who haven't had a period, and postmenopausal women. But also, like you can see women like in their 30s or 40s with lichen sclerosis. So there is a changes that happens, like inflammatory changes that happens to the skin, and as disease progress, it can change the anatomy. The clitoral hood can get fused, the labia minora can disappear, and it has this characteristic like white, like cigarette paper appearance and causes a lot of itchiness. So interestingly, in the study, women who did have lichen sclerosis, after regular application of the vibrator, there was a notable improvement in appearance of the lichen sclerosis. Again, I would take it with a grain of salt because we do need to have a studies with like larger number of participants. But that was a pilot study. We wanted to see like which area we should go to like kind of evaluate the vibration in like further details. And lichen sclerosis is one of them. And another very interesting finding is that the mental health improved among subjects in a study. So subjectively, they actually felt better, that their anxiety, that their depression significantly improved.
Wow. That's incredible. I mean, I've heard some studies before about the external genitalia, but I mean,
Uh-huh.
it's kind of fascinating to me that that's such an easy, approachable way, right? To like go after the floor to start before you ever go internally, right? And
Yeah.
we know like the one of the big side muscles, ischiocavernous, brings all that great blood flow there. So just tell us for us who are all in the medical arena, like what areas, up over clitoral hood were you doing? Were you doing side walls of vaginal vault? Like what areas did you kind of say, hey, we want you working on?
Yeah. So instruction was labia,
Okay.
perineum, and the clitoral area.
Okay.
So, if subject wanted to use the vibrator for like insertion, they just had to mark it that they did. But obviously, all of them use externally.
Mhm.
Um, the most difficult part of the study, the most difficult part for all participants that I noticed, it was switching between this perception that I should use the vibrator when I'm in the mood
Ah.
to
Mm.
the perception, okay, I need to use it as same way as like it's not like you like want to brush your teeth. You just have to brush your teeth. So so kind of going to that of just using it. You don't really like need to have an appetite. You just have to go and do it. And I think when that part was kind of like breaking, like mentally, that block was broken, then they were like doing it and they were noticing improvement. But I can tell you almost every single participant had that issue of like, I didn't want to, like, I didn't feel like I want to use it. I was not in the mood. I was too tired. So, and we always tired. We're not in the mood. So, but like it's kind of like we have to do it. Similar to like you don't want to like go for a walk. You don't want to do your
Mhm.
10,000 steps, but it's good for you.
Mhm. Mhm. 100%. In your study, how many people were in this study?
So in that study, initially the enrollment was around 100, and then when we finished the
Mhm.
study, people who actually completed it, there was 70.
Mhm. That's wonderful though. That's great. I mean, what a great information. For you to at least know, hey, that this vibratory input is actually doing something, and it's really it's a really important component. And I just want to segue back to what you just said. Like, are we ever in the mood? Because we're so busy with 75 things every day. So, like, that's a huge block to like move over, I think, for women, isn't it? To like help them realize, just like you brush your teeth. I think you and I have had this whole discussion who wants to put their makeup on and off every day, but the floor is no different, that we need to take care of it, right? Just like we do. You know what I mean? All of the other things that we women take care of and put cream on and off and all these lovely
Absolutely.
things.
And it's also like part why some people have like part of the low libido issues with relationship. I'm not saying have sex when you don't want to, but
No.
sometimes you do need to start doing something in order to get into that. So,
Mhm,
and it's a part of um, responsive um, responsive
mhm,
desire. And we
mhm,
know that women, predominantly majority of women, they have responsive desire, meaning like if you're not approaching me, I'm not thinking about sex. But if you
mhm,
start approaching me and I'm getting into the mood and I start engaging it, doing it, then I'm very glad that we did that. So also
mhm,
like knowing that, I think it
mhm,
helps in general with relationship. And also it's helpful when you have a device, you're not only using it when you're in the mood, you're using it because it's good for you.
How long do you think it took people to sort of cross over to that? Did they say that at all in the study, or was it more just something you just kind of saw happen? Or
Yeah, so I was the contact person. So they would like send all the like complaints and all the issues that would arise, and I would make sure that I call them and remind them because like I was in fellow and I was very eager to do that research. I was so grateful for all my mentors who like even
Mhm,
accepted this crazy idea at that point.
mhm. Yeah.
So, and I would like communicate with them any issues, anything I need to help you with. And they would say, like, oh, I didn't do the recommended amount of sessions because I was not in the mood. So it would take
Yeah.
like me to kind of explain, okay, I understand, but it's a part of the study. You do need to use it this amount of time, no matter the mood.
Mhm, mhm. I know I have a lot of women say, "Oh, well, I want to do it, but I don't know where to do it. And I don't know where to do it where no one's going to interrupt me. And I don't know where, I get a lot of that like in my pelvic health work that we do. And so I like am constantly brainstorming with everybody about all of those things, because it's not like they don't want to. They're like, no, no,
Yeah,
no, I want to do all my homework and I want to do the things that I know are going to help me, but I just got to figure out. And I think, isn't that a huge thing with women? I feel like is like, we're not sure how to take the time for our own self care. Like everybody else in your family does, right? But like, you're
yeah,
not sure how to tell everybody else, well, hey, this is the time frame that like, mom left for a minute or, or I'm the girl who left for a few minutes, right? But I mean, I'm just saying like those are the things that I think how do we sort of help women because I love this word you said, responsive desire, right? But like I always look at it like with my ladies, like it's almost like you're priming the pump. If you start doing things in more of a repetitive way, like whether it's exercising and going to the gym or walking every day or whatever, suddenly the body has this rhythm with it. It becomes habituative. It becomes
yeah,
like, oh, this is part of my lifestyle, all of that. And I think that's what we're trying to help women realize, just because maybe you reach this age or you're perimenopause or menopause or whatever, like, don't think that has to go away, just because people sort of said, oh, well, at this age, you're not supposed to want it anymore. So, like, why do you do? Why are you? So, I think us helping them, right, with, because I look at this as all a part of self care, right? Just like you said, you brush your teeth and you do all these other things. Maybe you don't feel like doing it tonight before you get in bed, but you do it anyway. So, those are the
absolutely.
ways. Mhm,
Yeah, no, I 100% agree with you because there's every period of life has its own challenges, right?
mhm,
So when you're young, you don't have any responsibilities, you finally start living on your own or like with
mhm.
roommates, it can be a little bit easier versus when you have like a kid, so you have a husband. Do you do it with like your partner? Do you do it on your own? When and again, we the women, we wire differently. Like I think I didn't truly understand that until my husband and I had a baby. So how different we've like we perceive the situation and how much we like appreciate the time for ourselves. So it's
Mhm.
and it also helps to like actually like share those tips and saying like, okay, this is would be a good
Yeah.
time. This is how you should do it. And sometimes even like giving it tools what to say. Like, this is the phrase. You're going to say it and then you're going to leave. It's very helpful. And as you age, it also comes with other challenges. And one of the common issue that I encounter is women who were a little bit more mature, like I would say they like 60s, 70s, 80s. One of the common concern was where should I keep the device? Because if something happens to me and my children and grandchildren will come to my house to take care like of stuff and they're gonna find it. Like, what should I do? And it's funny, but also at the same time, I also understand where they're coming from.
Mhm.
Um,
Yeah.
so and it was like one of the reasons why they were like worried to like ordering the device because they
Yes.
use the computer, but I don't know, maybe my grandson when he comes over, he able to see in my browsing history what I'm looking at.
Mm,
So this is a lot of valid concerns. We just don't think about it because
mm,
again, it's not something like commonly discussed.
mhm. And I think the more we have the discussions or the easier we make access for women and sort of normalize the conversation around the words and the starting from the self-care part but all the way to like the adaptability to like to actually if something's not going well with your partner while you're having sex being able to say, "Hey, hold on, let's change positions. Let's move over here. Let's do this. Let's do that." Whereas, like, maybe when you're young, you get away with just doing it however it happens, with no conversation. So I always tell my women so many times, like, this ups the ante on your intimacy level with your partner because now you have to actually say more of what you need. And some women will say, "Well, I don't even know what I need." And I said, "Well, that's kind of why we're talking about all of it. So you figure out like what feels better, what positions or what helps you more." And I
Mhm.
think if you don't help them find the words or maybe that adaptability inside of all of these things, then they feel afraid, whereas we say, "No, it's okay for you to say, like, oh, that didn't work very well. And I don't know where to put my device," and like come up with solutions, everyone together to help people have words, right?
Absolutely, yes. And I think like one of the examples that I sometimes bring to my patient, like if you go to the massage salon, like how would you explain where it hurts and where you want to get massaged? You can't just like, hey, can I get a massage? And just be quiet. You'll get like a something like very basic generic massage, but if there is like areas that you have an issue with, you need to communicate because we don't know.
Mhm. I love it. I think that's awesome. And then knowing, like I mean, you just brought it up, like the differences between a woman's response. I think people need to understand again, it takes longer for women to actually get full blood engorgement to their genital tissue than it does a man. And so that conversation becomes way more important, I see in my patient population as we're starting to get past those reproductive years of like, hey, or maybe even during reproductive years, like right after a baby, some of my ladies are like, well, I'm scared to have sex or I'm scared to have anything done down there because I don't know what it looks like and I don't know how it's going to feel. And I'm like, okay, well, let's start slow with things, maybe with vibration or maybe with external things and make sure the tissue is healing well. So which leads me to my next lovely question. Will you tell us about Sensara? I saw that you won some awards and I was super excited and that's kind of why I reached back out to you because I was like, okay, I need to hear all about this feminine wellness and definitely self-care pleasure is how this was designed and come up with. So share with everybody because I think it's fascinating. We're trying to mainstream and help women, not with their body and their sexual health. So this just goes right into the neighborhood of all the things that you've been talking about.
Absolutely. Yes. So, Sensara, it's a new AI driven um, wellness device. And the company found me, and the company is amazing. It's based on three different countries in United States, Los Angeles, and Israel. I'm sorry, it's based in three different countries in United States, Canada, and Israel.
Mm,
And um, they done a very impressive work on creating and designing a specific sensors that will help create a very personalized experience and help women to experience better pleasure and adjust to their body as the body changes. So the way how device looks, it's a Y-shaped device. When you just give it, like when you just look at it, at first you think like, okay, it's another vibrator. It does vibrate,
mm,
and it has a part that you can apply to the clitoral area. You can choose to just apply vibration or also add suction. And with
mm,
suction, there's two types of women, I like to say, one who loves that suction and who hates that suction. So whoever you are, you
Mhm.
have a choice. And then device
Mhm.
comes with a special pod that contains the lubricant. And there are different types of lubricant. So those pods loaded in a device similar to like a coffee machine. Um,
Mhm.
and there are two sensors. And those sensors, they detect changes that happens to the body during sexual activity. Sensors to
Mhm.
monitor changes in a heart rate, in the blood flow, friction, level of natural lubrication. And based on the data, device analyzes all this information and produces additional lubrication um, through the device that been delivered internally and externally. And
That's
what's
incredible. Let's just say that.
I mean, it's incredible because it's very helpful for
Mhm.
like many clinical scenarios. For example, women who is on birth control, women who's postpartum, who's breastfeeding, perimenopausal women when they suffer with the vaginal dryness. And also there is this misconception that if you use the lubricant, something wrong with you. Even though the studies have shown that if you use the lubricant, you experience greater pleasure. So it covers the lubrication part very well. But what's interesting is you can use device just on its own, but there is also an app. So you can pair the app with the device, and on the app, you respond on a certain questionnaires that assess your health, that assess your sexual preferences, if you prefer device warm or you prefer it cold, what type of vibration patterns you like, what intensity, how lubricated you like to be. And it creates kind of programs, and device gets all this information back from your body to the app, analyzes it, and create and builds on those experiences.
Mm,
And the next
incredible.
level is that you can share this data with the users basically. So device will learn, and that's why we got the AI award, um, because the device will analyze the data and help to create a better experience.
Mm.
And obviously, I was very excited when I just heard about the device, and I think there is a lot of potential to
Mhm.
do more research. And actually, this will allow us to open the door to learn more about orgasm, the
Absolutely.
function, and how we all experience orgasm and pleasure. So I think it's very important. And I know there is no other such device that using AI to to improve the pleasure and also bring the wellness.
Mhm. I mean, I think this is amazing. I mean, my mind's going like, oh, think about the pelvic floor muscles, think about all the tissue in the floor and all the changes that can happen because now, it's learning a person's body and knows kind of what it needs. And these little pods, you guys, they also have ones for more wellness, ones for more pleasure, right?
Yeah, so there are different types of lubricant right now. There's only like two, and they water
Okay.
based. One just a little bit more stimulating, another one more moisturizing, with the goal that in the future there are going to be more choices because not
Mhm.
everyone likes the water based lubricant. So there are going to be more different pots, so you can pick and choose which one you would prefer.
Mhm. That's fascinating. Wow. Okay, so I mean, if you're allowed to say where you're at with all of it, are these on the market yet? Are they coming? What's going on?
Yeah, so they will be available to order in like April and May of this year. If you go to the website, sensarawellness.com, you can actually sign up for early bird like notification. So you will receive email when the device is on the market, when you can order it. And when the device arrives, you're going to get a device charger several pre-filled pods and instructions on how to download the app and like what to do.
That's wonderful. Alexandra, tell us, like in your mind, because you've done research in this neighborhood and with vibration, et cetera, how do you feel like, when you just think about that, like what will it do for us to help us to have more data?
Yeah, well, we're in the United States, right? So it's a lot of data protection, and I think companies doing incredible work, make sure that the data is protected, identified, and everything. But I think
Mhm,
like with the women, like nobody there to help us unless we help ourselves and each other. So I think the more users we have, the more data we have, we can actually determine, like we can research the more like lubrication pattern, vibrator pattern,
mhm,
orgasmic patterns. And all the sensors that they use in technology, I think there is a lot of things that we don't know yet, but we
mhm,
will if we have more users and more data from more users to analyze it. And I mean, I'm very excited. And as you said, like my mind goes wild just thinking about all the possibilities.
mhm.
And
Yeah, and
obviously, I mean, it's not like a overnight thing. It will take time.
mhm,
Um,
mhm.
but I do know that soon we will be able to use this device to probably do more research.
Mhm. Yeah, I mean, I'm just thinking about the muscles alone, because if those sensors are able, to detect, oh, all of a sudden, I mean, because we don't really know everything that goes on in the pelvic floor during sex, right? Because we have never really studied women's muscles in the floor in the way that something internal like that could do. And who's
Exactly.
actually,
And how about women who has a pelvic floor disorders like laxity or prolapse? Or if we fix those disorders, what happens then? So there is a lot of things that we don't know and we still need to research. And I'm excited for it.
well, and I see it even in my pelvic organ prolapse patients. I mean, it's interesting because I know you know that work so intimately, right? And we see just alone, just with external work and internal work in the floor. I mean, you mentioned it before with vibration, but even
Mhm.
if we never even used vibration, we already see improvements with pelvic organ prolapse issues just because think of it, you're actually touching a tissue, you're actually getting the brain to recognize, hey, where that tissue is. We might get them in certain positions to uplift areas, and say, oh, did you get the sense of that? So I think I mean, this whole idea of, oh, changing maybe the way that we're going to even treat people because we'll have more details of like, hey, what is actually going on? Is that tissue actually being affected by doing these things or is it not? And I think too, the whole idea of, I love what you said earlier about lubrication too, because I have a lot of, younger women as they're kind of getting a little bit older, like they'll all of us, well, I was all, I don't need any lubrication. And I'm like, maybe after babies, right? Especially it comes out in a lot of my postpartum women. And I'm saying, well, there's nothing wrong with you right now if you don't have the lubrication. And if later, if you have it, great right now, but there's nothing going to hurt you to use more lubrication so you have less friction. And I think you brought that up before, like, having more blood flow gives less friction between organs. So now organs can actually move and slide and glide better. Talk about
Yeah.
that a little bit for people so they kind of get why is that important? Because I don't want that there to be a drag to tissue, right?
Yeah. Well, there's certain things to it. I think it's important to say what lubrication is. It's
Mhm,
not only secretion. We do have like a secretory glands that produce the lubrication, like Bartholin glands, like periurethral gland. But the lubrication of the vagina, it's actually transsudate, meaning like what it means in English is the blood vessels that behind the wall of the vagina, when they bring the blood to that area, as like, let's say we get aroused, the fluid from the blood goes through the vaginal wall And that fluid, that moist environment, that's our lubrication. So I think it's very important to understand. So that's why the if we increase the amount of blood flow going to that vaginal wall, we're going to increase the amount of lubrication. And if we have that lubrication, it also fits the good bacteria that we have in the vagina. So they're going to continue grow the good bacteria, and it's going to support our pH of the vagina, which also supports the vaginal health, prevents urinary tract infection. So there's a lot of things that comes from this like simple like just lubrication. And when we sexually aroused, we have more of that lubrication because again, arousal is the whole body participates in arousal. We have increase in heart rate, we have increase in our body temperature, flushing of the skin, blood goes to the genital organs, and the more stimulation we get, the more blood going there. But again, you might get wet very fast when you like 23, but when you get a little bit older and you develop more chronic condition, it might take a little bit longer. And we know that in general it takes longer for women, but it can take even longer. So um, if we have a device that can speed up that process, um, that's excellent. And also, if we just add the lubrication um, just to start the process, because again, the more stimulation is applied, the more production will be. So if we use the lubrication to start process maybe a little bit early, it will also help with production of more lubrication.
Yeah, I think this is great conversation because especially, do you know what I mean, as we get older and if we've been doing it less, right, then we're not going to have as much because we haven't been doing it as much as we did when we were 23. So, and after baby, I think too. I mean, I think there's an important discussion too after baby because people are stressed a lot, after baby and, if they're nursing, et cetera. And we know, all that lactation component, maybe there's just not as much lubrication and you're not a failure if it's not happening like it did before. Like you're not. This is part of the body's changing, right?
Yeah, and again, having birth, whether it's vaginal or C-section, is a tremendously traumatic event for the body. Even though the bodies have been doing it for like many, many years, it's still a trauma to the pelvic floor muscles, to the nerves, to all the organs. Even though you might not require stitches, it's a big deal. And it takes time for all the organs to recover. Like similar if you fell, if you played sport and had like ligament tear, it's gonna take time. And you're not expecting the organ to work appropriately, be painless right away. But for some reason, we have that expectation. Oh, you gave birth. It's so natural. Yeah, you should be like all good. But it takes time. And like going, like, this is just like what's physically happening, right? On top of all the hormones. But what else is happening? There is a sleep deprivation. You like trying to survive. You definitely not always thinking. I would say you're not thinking about sexual activity, and there is a lot of like relationship based issues going on. So it's not only the organs, but you do need to be very kind to yourself and let body recover, go to pelvic floor physical therapy. And as you mentioned, women are scared. Like, I just had this like 8-pounder baby come out of me. Am I okay? How the sex will feel? So it's actually better to start investigating how all your anatomy and organs work on your own. And maybe using some device, exactly like including the vibration. Vibration can also help with the pain, similar how like any muscular massagers can help with pain, can help to make a process a little bit easier. And also with the lubrication, you might think that you don't need it, but the device can actually help you to determine like, oh no, you actually do need it. So I think it's very helpful, especially in such a critical period of time when you just had a baby.
Mhm. Yeah, yes, and I think this is so important for people to just absorb in that, hey, this was a big event that happened, and you're not expected for everything to be working as it was before. But there's all kinds of tools and things, and to whether it's to PT or whatever, to actually help you, so you get this part back. Because I think suddenly, I don't know if you ever felt like this, but in the beginning it was almost like, oh, I was so worried about the baby and everything the baby need. I like forgot like about my own self-care, what I should even be doing. And I'll have moms sometimes have been, 12, 18 weeks, and they're like, well, yeah, I need to get back to that with my husband, but like I'm kind of afraid. Could you just look at me down there and make sure everything's okay? And I'm always like, okay, well, let's talk about it, right? Because, maybe everything doesn't feel like it exactly felt like before. And I think that's why vibration is an easy thing to start with, right? And I love that your study did it externally because it sort of takes the fear away. Do you know what I mean? And I tell you what happens so much of the time, and you kind of mentioned it before, that the majority of women have, external orgasm with their clitoris anyway, right? And so, hey, start that process. And then I do think the desire comes back, and you're not even going internal yet if you're afraid or if you're worried. And we always start externally when we're teaching and educating, our ladies, because we want them to know, hey, we're not asking you to do something that's painful or uncomfortable. We're just going to get you to start moving just like you would after you broke your arm or your wrist or whatever. Like, we're going to get you to start moving to help that tissue sort of get its resiliency back and start to build, like the layers of the tissue back and the rugae and the health of tissue. And I think that's the beautiful thing, is that people, I think, don't come in or don't talk to you or don't have the conversation because they're afraid, oh, they're just going to tell me to go do X, Y, and Z. I'm like, no, that's not what we do, right? We start in these really easy, gentle ways to kind of bring people along, just like you would any other thing on your body that you ever injured.
Yeah, 100%. And I think it's very important to switch that um, perspective for women.
Mhm. I 100%. And I think the more we talk about it in these ways, and there's more things available, I think that's why I was so, when I saw the pods and that could dispense lubrication, and I was thinking, wow, that's so nice. And then there's part of it that's external and there's part of it that's internal, and you could use things differently so that it's not feel so intimidating, because I do believe that's a component too. Sometimes people feel super intimidated, and so, especially some of our older people, right, who maybe have never used a device or used a toy or used any products, or never don't even know how to talk about it. I mean, sometimes I'll have people who say, well, you buy it for me and then I'll buy it from you, because they don't,
Again,
so
what if my
they,
grandson can track my browser history? Yeah, and see what I'm ordering. What if it arrives in a clear package and left by my door?
yeah, and the mailman knew too, right? Or the FedEx guy, or the or the
Yeah,
Amazon
giving
driver.
a little wink.
No, I think all of those, they all those components come in. So tell us a little bit, Alexandra, like where are you, like, if you had one thing out of the gate that you feel like, hey, you really want to learn from this new product, what would it be? I know I'm putting you on the spot.
You do, yeah. Well, I think what I would like to learn, because there is a certain sensors that more than just muscles. I
Mhm,
am very curious about the friction sensor that also will
mhm,
determine, like, we know that the vagina, when we experience the orgasm, upper third of the vagina kind of balloons and elongates. So I'm actually very curious what exactly happening with that part, and how is
mhm.
it changing if women has pelvic floor disorders, and how it's
I see.
affect the orgasm. That's like my little bit like a nerdy interest. It might not be like very common, but I do think sometimes we pay too much attention to the length of the device or like all the cool features, but I think there's so many things that we still don't know about, like our anatomy and what exactly happening. And I do want to have that knowledge. So whenever I do the surgery, I know how I can adjust, do something or not do something in order to
Uh,
not impact the pleasure, the sexual part of the organs.
mhm. I love this. Okay, so what would you say to physicians out there who aren't even talking to their patients about sexual health? Like, give us some way that's easy that they can start actually having the conversation.
Yeah, well, I think before any physician starts having conversation, I think it's important to make a decision for yourself as a physician. Do
Mhm,
I want to talk about sexual health, or would I rather refer? And there is nothing wrong with referring. Like, I don't want to talk about, I don't know, your lung disease. I'm sorry, but like, there is people who
mhm,
can do it so much better than I
mhm,
would. So you do need to pick and choose what your priorities are. So if you're a physician who don't want to talk about sexual health, but you kind of feel like, okay, I need to address it. Um, have the referral source. And in every area, there is a person who specializes in sexual medicine or whose passion it is. Have the contact information for that person. So whenever you see a patient and you evaluate all the organ system, instead of skipping that part of questionnaire, you can ask, um, how's the sexual life going? Um, are you active with other people, with yourself? Do you think you have any concerns that you would like to address? And if the person start opening up and saying, yes, I have a few, you can always say, you know what, I think I have a perfect person for you. And you can hand them the
mhm.
card of that person. So that way, you kind of show them the way where to go and brought them to the people who can help them, but you also like didn't ignore them. And the patient will be forever grateful to you.
Mhm.
If you're a person who want to help with sexual function, you a physician who want to help your patient, then it's a different conversation. You do need to educate yourself first, and there is a different resources, different societies like International Society for Sexual Medicine, ISHWISH. They're all great places where you can actually learn, educate yourself, and then educate the patient. You're not going to always have an answer, and sometimes the patient brings something up that I don't know what to do. But that's why we have this like very tight network of the providers who help with sexual health, and I have all the phone numbers, and I literally like text message away, hey, had this difficult case, have you seen it? Because the field of women's sexual health, it's such a new field, we can't just like go and open like huge book and research there. There's like not so many books written on this topic and like find the answer. So it's kind of like, like trial of error, trial of like what other people doing, what works for you, what research had said, and it's building up. And I started being interested in all this area when like right before my residency around like 2015. And I can tell you that between 2015 and 2025 we had so much advancement in the area of sexual medicine happen that, but it's all doesn't happen just like in a vacuum. It's all about people working together, putting their brains together and advancing the field. So if you're a physician who want to be like part of this big family of sexual medicine providers, be it. Nothing stands on your way. Just keep accumulating the information, meet other people, and just start helping people.
I love it. Thank you for sharing that. I think it's so important because I think if you're not comfortable with it, how can you be comfortable talking to your patient about it? And it's okay if you don't want to do that, but knowing, hey, that's not the conversation I can have. Hey, I'm going to hand it off to somebody else. But, if people are willing, there's such great need. Don't you feel like too that we need more people to help us actually in these conversations in the medical space because there's so many people who have, maybe it started out as, a pelvic organ prolapse and now it's sexual health issues or, they had a leaky bladder and it rolled into sexual health issues because that leaky bladder got in the way. I see a lot of that. Maybe it didn't start out as that, but it rolled into it.
Yeah, absolutely.
Mhm. Well, I thank you again so much for being with me. I always love talking to you and I love our conversations because I think it helps broaden, our ideas. I think how do we change the narrative? How do we have more conversations? That's all we're trying to do. And I love this Sensara that you're talking about. It's going to be super interesting to see if it can't be maybe used in research too to help us in so many ways continue, right, to learn about sexual health so we know how to care for women better in this space.
Yeah, thank you so much for inviting me. I love our conversation. I feel like the only thing that's always missing is like a glass of wine. We should do the next
Yeah.
episode with a glass of wine.
Okay. So that's what we'll do next time. We'll absolutely do it next time. And I know you're going to have so much more to tell me in this next year as this year goes by because you're going to be doing even more things. So I love it. And I look forward to one day hopefully meeting you in person. So
Absolutely. Same to you, Sherry. Have a great day.
thanks, you too. All right. Bye.